Welcome to the PAH Today National Broadcast Series. I'm Dr. Lana Melendres-Groves, and I'm the Medical Director for the Pulmonary Hypertension Program at the University of New Mexico. And it is my distinct pleasure to be here to talk about the inside story. What would your body tell you about your PAH if it could? First, let me provide the following disclaimer. This presentation is sponsored by and made on behalf of United Therapeutics, UT. Healthcare professional speakers are compensated by UT. The scientific and clinical information contained in these slides have been reviewed by PHA's Scientific and Medical Oversight Committee. The Pulmonary Hypertension Association is not responsible for the content of the presentation and do not endorse any pulmonary hypertension drug manufacturer or their product. This presentation is for educational purposes and is not a substitute for your doctor's advice. Note that not all medications are appropriate for all patients. Please talk to your doctor to determine the right treatment plan for you. What about these symptoms? What if they could tell you, hey, I don't feel good? What's that telling you about your PAH? Before we can talk about symptoms and what those symptoms might be telling you, we have to really talk about what is pulmonary arterial hypertension, or PAH. It is a rare and serious lung disease. In PAH, the blood vessels in your lungs constrict and thicken, making them more narrow. These narrow blood vessels are harder for the heart to push blood through, which can lead to higher pressures in the blood vessels and less blood flow within the lungs over time. What does less blood flow really mean? It often means less oxygen delivery to the body. The restricted blood flow through the lungs leads to decreased oxygen delivery throughout the body. So I want you to take a moment and look at the figure on the screen. This is showing you heart, lungs, and the flow of blood through the heart and lungs. Look at the blue side of the heart. That's the right side of the heart. The right side of the heart receives deoxygenated blood back from the body. And the job of the right side of the heart is to take that low oxygen blood and push it out into the blood vessels of the lungs, where it can pick up more oxygen. Once it's picked up that oxygen, it returns to the left side of the heart, which is the red side of the heart on your screen. The left side of the heart will then take this oxygenated blood and push it out to the body to help your body do all of its daily activities and do them well. Oxygen is essential for carrying out normal activities. That's why patients with PAH often find themselves more short of breath and have difficulty completing daily tasks. When we start talking about symptoms, they can be very important clues to some of the changes that might be occurring inside your body. For instance, patients with PAH may feel shortness of breath or chest discomfort or chest pain. These types of symptoms may occur due to heart strain or excess pressure on the heart. It may be also because the body is not getting enough oxygen. Often patients will describe a swollen or distended abdomen. That might be signs of congestion within the liver. And how about those swollen ankles? Often that's a sign of increased fluid retention caused by the right heart dysfunction or potentially because of excess sodium in one's diet. Once the heart becomes strained over time and is unable to compensate for those changes within the blood vessels and carry that oxygen out and deliver it to the body, it starts to become fatigued. Just like you become fatigued, you may experience lightheadedness or an irregular heartbeat. And that often is an indicator that the heart is less efficient and it's becoming more difficult trying to do its daily tasks. This is due to the fact that the heart pumps more forcefully as those blood vessels become narrowed, and that over time strains the heart and can even cause the heart to go into heart failure. That strain over time worsens, and the heart can't keep up, And as it starts to fail, we start to see that our patients become more dizzy. Sometimes they even pass out, they faint, they have these irregular heartbeats, and they overall start to feel much worse. Their activities become more limited, and all of that is because of the heart and the strain on the heart due to those narrowed blood vessels. What would we love for all of our patients to do as your providers? We'd love you to track those symptoms. Find a way that works for you. One example may be to download the PAH symptom tracker from the PAH Initiative website. This allows you to record your symptoms and when you feel them, recording the activities that you may be doing that could trigger them. But more than just recording your symptoms during activities, maybe you should also record the activities that you've stopped doing or do less of. Often that is the way we compensate when our heart starts to become more fatigued, is that we do less because it doesn't make us feel good. And those are also important clues for providers to understand not just when do you have symptoms with your activities, but what activities have you actually limited yourself in doing. And don't wait. Tell your doctor. Reach out if these are things that you're experiencing. Every detail helps your care team. So we talked about what your symptoms might be telling you, but what about the right side of your heart? What if it could talk? What would it tell you about your PAH? This is where it gets a little more complicated because often the heart changes before someone may even experience those symptoms. I think about it in terms of that seed that you've just taken, planted in the soil, you're watering it, you know you're doing all the right things, but yet you've seen no advancement. There's nothing coming out from the soil yet. And it's not until everything happens underground that that plant can start to bloom. Well, when we think about the heart, some of the things that are changing may not be to the benefit of our patients. These changes could be that their PAH is worsening. And before you start to experience symptoms, the heart has already experienced those changes. So in order to try and understand what might be happening underground or inside you, we need tools to be able to take a look and visualize those things because your symptoms are important, but also those changes within the heart, maybe even before symptoms, are key to the success when we're managing our patients. So how do we monitor the right side of the heart? This is where these echocardiograms or echoes come into play. Often, we may be asking you to get them frequently, and our guidelines would indicate that we should be getting echoes at least twice a year for our patients with PAH, if not more often. They allow us to see changes in the size and shape of the heart. We're able to look at how the blood flows through the heart and evaluate how the heart is squeezing or pumping blood through those blood vessels. It really helps us to monitor the person's disease over time, and that will allow us to make adjustments to your care plan. We talked about the symptoms. We talked about what if the heart could talk. Now those blood vessels. What if the blood vessels in your lungs could talk? What would they be saying? Well, again, we'll use an analogy because I find that when I start to picture things, it makes it much easier to understand. Our body produces 4 natural substances that help the blood vessels in the lungs stay healthy and working normally. If we think about a car and the 4 tires on our car, we know that those tires need to stay in balance. The pressure within each tire is essential for that car to run smoothly. The same for the substances within our body and how they work within the blood vessels. Those 4 substances are key to keeping us in balance so that we also have a smooth ride. Each of these substances is key to how the blood vessel health is maintained. An imbalance of one or more of those substances can cause narrowing of the blood vessels and thickening of the walls of those blood vessels. Over time, that can lead to excess strain on the heart and inability to get blood through those blood vessels efficiently. What does that mean? Well, worsening of someone's PAH symptoms. So our job is how do we get those back in balance? This is where our PAH medications come in to help restore that balance. We have, just like the car, four of them, four tires, and we have four substances: the prostacyclin, the endothelin, the nitric oxide, and our activin signaling pathways. Each of these does something different. These PAH medications can either slow down the production of a substance that's being produced too much of, or it can replace or increase the production of a substance that may not be enough of. All of these things help to get an individual's PAH back into balance so that we're able to increase someone's activities and allow them to participate in their life in a smoother ride. This is where our guidelines are very essential to how we manage our patients. We know that research has shown that taking at least two types of PAH medications may help improve someone's symptoms and some of the other outcomes that we look at in our PAH population. For instance, we look at how someone might be doing from an activity standpoint or functional class. It helps to improve their ability to maintain those daily activities and continue to be part of their life. Additionally, we are often asking you to get 6-minute walk distances. Using two or more of these medications have shown is that we may be able to improve someone's ability to walk further and thus do more. Happier vessels leads to a happier heart. A better balance in those substances may allow us to help meet the goals of each of our individual patients. And each patient is individual, and that is why it's essential that you speak up as a patient or as their caregiver, because what we really are looking to do is how can we partner to improve lung function and open up those blood vessels or dilate those blood vessels? How can we improve the heart function and the strain that that heart may be under? And ultimately, how do we help a person feel better and have fewer symptoms? I would love to say that I know what to do from the get-go. Guidelines help us, but because every one of my patients is just a little bit different and they have unique aspects of who they are, adjustments are part of the PAH journey. This is where me discussing with my patients and my patients discussing with each of their PAH specialists helps us to make those adjustments in your medication and care plan. Should we be adding or changing medication? Should we be adjusting the dose of a medication? Those should be the dialogue and conversation that you're able to engage in with your provider. Or maybe it's about lifestyle changes. Should you be starting an exercise program or cardio or pulmonary rehab programs? Do we need you to start adjusting maybe some of the diet and sodium intake? And always essential for all of us, how do we make sure that you're getting the rest that you need and the emotional support that you deserve? These are all things that you need to take into account when you're preparing for your next appointment. And I know that can feel overwhelming. That was a lot that we just discussed. Having tools to help you remember each of those aspects becomes so important. The PAH initiative also has a doctor discussion tool that you can download at the QR code that you see on your screen. This may be a nice guide for you to navigate those conversations with your specialist, to talk about your symptoms and your activity level changes, maybe to learn more and discuss what your risk status is and why that is important in terms of your medical care, how your treatment plan may be adjusted based off your needs, and if medications are being added or changed, what types of side effects might you expect or need to be able to manage as you do so? I know that was a lot in a short amount of time, but here are some of those key takeaways. First, your symptoms tell a story. Track them. Talk about them. Talk about them with your caregiver. Talk about them with your support team. Talk about them with your specialist. It really is essential as part of how we understand what's going on in those blood vessels and the right side of the heart so that we can be committed to improving the symptoms that you're experiencing. Second, ask your doctor how they monitor your heart. We talked about the echocardiogram, but there are different ways that each person may be getting specialized tests to look and be proactive in making adjustments to your care plan. Third, PAH treatment is a rebalancing act. One or more of those substances could be out of balance and affecting the blood vessels and how your symptoms are being expressed and what you're feeling. So, we need to be able to try and work together to rebalance and get you back on the right track. And fourth, your PAH story matters. Share it. Be an active participant in every discussion with your specialist and others. That will allow us to work together and, as a multidisciplinary group, make sure that we're giving you the best possible care. I would invite you to learn more, find support, and connect with others through the Pulmonary Hypertension Association, www.phassociation.org. I want to thank you for joining. It is such a pleasure, one of the best parts of my day, to be able to come and talk about PAH and hopefully to help you advocate more for yourself or for someone you love. Please join the initiative at pahinitiative.com/join. This is where you can hear about future broadcasts, get a free copy of PAH Today magazine, learn more about your PAH, and be inspired by others. Also, you can connect with us on social media. Thanks again.